I'm joined by Andy McDonald. He's a trade unionist. And actually, we've got a change this week. We've got the right in the corner. That's author Harriet Sergeant. Welcome to the show for the first time, Harriet. We're going to get straight to it. Christmas is coming up. Strikes in the NHS, Andy. Strikes on the railway system. Isn't it time now that they just put the strikes to one side over the Christmas period and let people get on with their lives and let people have that hospital treatment that they so badly need?
Oh, no, I don't think so. I think the government need to offer a good deal to ours left. The Train Drivers Union, the conditions and the pay increase that they're going after isn't unreasonable. Mark Harper's just been operating in bad faith for the last year and a bit. It's been poor from the government. It's time for them to step up.
What would you say to train drivers, to the members of the public, Andy, who's earning 25, 30 grand a year, that can't get to that relative at Christmas, can't get to that important hospital appointment because train drivers earning 60, 70, 80 grand a year want more money?
It's not just about money, in fairness. It's about conditions. It's about contracts, and it's about pensions.
Yeah.
It's not just about what's in their pocket at the end of the day, but they do deserve a pay rise. They haven't had a pay rise in about, I think, 7 years. They've lost 12% proportionally. It's poor. They need, they deserve it.
Let me go to our right in the corner, Harriet. I mean, Andy's saying that they've not had a pay rise for so many years. They deserve it. You don't see many train drivers leaving the profession to go for another job.
No, not at all. In fact, the opposite. I mean, I think there is an argument for saying, yes, you've got to pay people more if you have a shortage, like we had with lorry drivers. So, they got an increase and they got their conditions improved, and lo and behold, we don't have a shortage of lorry drivers anymore. Sure. But that's not true of train drivers. The train operating company says every time they advertise a job, being a train driver is so popular, they get 300 people applying for just one job. And if they advertise in the north, 750 people apply for just one job. And they have to close the application after 1 or 2 days. So there is absolutely no argument for a rise for train drivers when so many people want to be a train driver. And I happen to know this. I became interested in this because at the moment I'm helping 2 young men who are just coming out of prison. And both of them are really eager of all the things that they can do. They want to go and work on the trains. Yep. And they're former drug dealers, so they know a good deal when they see it.
About transport. Look, Andy, I think Harriet makes a good point there that for every vacancy driving a train in the north especially, 750 people are applying for these roles. That sort of casts into doubt your theory that it's about pensions, pay, conditions. Why are so many people applying for these jobs when they're so poorly paid?
Well, we're not saying that they're poorly paid. It's just they haven't had a fair pay increase for a while. But you look at how many people apply to be MPs, how many people apply to be on those shortlists, how many people run for Parliament, but MPs get a pay increase every single year.
No, they don't.
Yes, they do.
No, they don't.
They have for the last 7 years. They've had a pay increase. Yes, they have.
No, they haven't, Andy. We went a year without a pay rise.
You went a year without a pay rise.
Yeah, well, you just said every year, so get your facts straight.
So you took 1 year off.
Yeah, and I always give my pay rise away to good causes.
Well, that's fantastic.
In the local community.
Congratulations. But a lot of those MPs don't.
Yeah.
Does Mark Harper?
Well,
his minister, he's on 120 grand with his
minister. I think the last pay rise we had was about 2 or 3%, and I know there's not much sympathy out there for members of Parliament.
Well, they'd be asking for if you gave 2 or 3% every year, you wouldn't have an accumulative 12% figure.
Yeah, where's the 12% come from?
The 12%, it's the accumulative figure.
I think Harriet.
Can I just say something more about this? Andy raised the point about pensions and conditions, but we see the same there as with everything else to do with the trains. I mean, train drivers have an amazing, they are the aristocracy of pensions. Yep. They have sort of gold-plated singing and dancing, goes up with inflation.
Are they better than bankers' pensions? Are they better than bankers' pensions? Barristers' pensions?
Well, I'm talking about train drivers.
You're saying they're the gold standard of pensions?
All right, if you bring up,
the gold standard in the train industry, what compared to cleaners?
You're bringing up a barrister. Okay, well then look at a solicitor. Train drivers are actually paid £5,000 more than solicitors.
Well, that's not true because there isn't a standard wage for solicitors.
No, they're compared to nurses, for example. Whose a ward nurse gets about £31,000 a year. A A train driver average wage is 54,000. That means that people get a lot more than the 54.
I think under the Tory rule,
And
NHS,
no, wait a minute.
I would advocate for an increase for
But
nurses
also,
as well.
can I
in
just say
fairness.
the training as well. I mean, nurses are doing 3 years worth of training.
Yeah.
They're having to deal with incredibly stressful situations, life and death situations on the wards. Train drivers do 6 to 9 months, and then they're sitting in this sort of cozy cabin, completely sort of insulated from the public.
There's a big difference there, isn't there? I mean, Harriet's right what she says. The people working in the NHS, like nurses, they do a hell of a lot of training, a lot of new degrees now, 3, 4, maybe 5 years. Some going to specialist jobs in nursing.
And you still wouldn't give them a pay rise.
It's very
That's why the NHS is still striking.
Very intense career progression. But, you know, no disrespect to train drivers because they do a cracking job, they do a brilliant job, a stressful job sometimes, but 6 to 9 months training and they're on 50, 60, 70 grand a year.
Yeah, well, I would agree that nurses do deserve to be paid more. I agree with you. You know, there's no disagreement there.
Yep, absolutely. Harriet, illness is not seasonal, and there will be a lot of people over the festive period wanting to get to that important, vital hospital appointment to get that treatment or that care that they need. Isn't it time, like we just said previously with the train strikes, that, you know, there's a bit of common sense used, because they will lose public sympathy very quickly, some of the NHS workers, if they're striking over Christmas, and, you know, vulnerable people can't get to the hospital to have that important treatment that they need.
I mean, I think it's appalling. You're talking about the NHS strikes. No, I mean, it's absolutely heartbreaking. I mean, there are people literally dying on waiting lists. There are huge numbers of people who can't work, who are sort of sitting around in pain and agony on waiting lists. And this strike is just going to exacerbate all of that. So it's completely heartbreaking.
Are they being scrooged, the health unions?
I think it's more the Department of Health than anyone. You know, it goes back to that responsibility of them to offer a fair deal. Yeah. They just won't negotiate. They won't negotiate in good faith. Yeah. It's poor from the government. They need to do better. It's their fault. These strikes have been going on, almost a year now, just over a year. It's poor from them. They need to do better.
So you're saying it's the government's fault that people decide to take strike action?
It's the government's fault when they don't offer fair contracts, yes. Okay. When they don't offer fair pay increases to those on the front lines. You know, it's a government establishment. It's part of the British identity, the National Health Service. I'm sure you're as proud of it as I am.
I am proud of it.
You know, we need to pay their staff fairly.
I don't know what Harriet thinks, but I actually think the NHS gets enough money. I think it wastes a lot of money. We see some of the trusts now advertising ridiculous diversity roles, paying 60, 70, 80, even 100 grand a year. Surely that money should be used to go back into nurses' pay packets. Harriet?
Yeah, well, I spent about a year investigating the NHS, meaning I was in about 6 different hospitals, shadowing staff, everybody from porters to sort of CEOs, and sitting in on meetings, following nurses around. And I was pretty appalled by it, actually. I did that in 6 different hospitals around the country, and I saw a lot of suffering by patients. Yep. I saw managers, well, I didn't see managers. Yeah. That's the whole point. I mean, as the porters told me, and they're very, very interesting on what's actually going on in a hospital, you never see managers. And when I did go and see the managers, they were always in a separate block, usually modern, pristine, and they never seemed to come anywhere near the hospital. They were always managing to the centre, to the central demands, which had nothing, they had no idea what was going on in that hospital, and nothing to do with what was happening.
Harriet makes a fair point. Poorly run, NHS.
13 years of Tory Bristol, what more can you expect?
Yeah, but the government don't run the NHS. And
well, they delegate.
The trust.
They do set the precedent. If the government said fire all the diversity staff, the trust would fire the diversity staff.
Obviously, Harriet's been there firsthand. She's seen the waste firsthand. She's seen sometimes the treatment of the patients is not up to scratch. And managers, out-of-touch managers, in my opinion, sat in an office block a million miles away, haven't got a clue about the health service.
Yeah, I completely